We are now going to study some subtleties, comorbidity study method. Comorbidity records diagnoses that occurred in a defined time interval related to the subject's index date. It assigns those diagnoses to 16 diagnostic clusters. It records whether a diagnostic cluster is seen at least once in the interval. It assigns weights to each of the diagnostic clusters. It adds these weights to get a comorbidity score, which we call in the application a Charlson score. It then calculates an age-related score component, which is identified in our application as an age-related risk. For every 10 years above age 40, it gives 1 point for age. It then adds the age-related risk to the Charlson score to obtain what we call in the application a Charlson with age score, which is called colloquially in the real world the Charlson score. So these are the diagnostic categories, the 16 diagnostic categories that are searched for. You will notice that some are versions, more severe versions of the preceding one. For example, you have mild liver disease and moderate or severe liver disease. If you have a number of diagnostic events, one with a mild liver disease and one with a moderate or severe liver disease, the Charlson score will only weight the moderate or severe liver disease one time. Similarly, you can see diabetes without chronic complication, diabetes with chronic complication. The score weight for diabetes with chronic complication is much higher, and therefore, if over an interval of time you have two diagnoses of these two types, it will only count the most severe one. And here we have any malignancy and metastatic solid tumor. The time interval for diagnosis capture. The application has a start flag, has a backward arrow since you're going backwards in time, and it has an end arrow that collects the end of the interval. So in this picture, we're going to collect all the diagnoses from day 0 to day 180 and assign those diagnoses to their appropriate cluster. It starts at the subject's index date. It goes back to the end of the defined duration. In the default, it's 180 days, but this can be changed. On what day are diagnoses captured? For hospitalization diagnoses, they're captured on the date of admission. For emergency diagnoses, they're captured at the moment of ED triage. For outpatient visits, they're captured at the date of the outpatient visit. For ambulatory surgery, it's the date of the ambulatory surgery visit itself. This is quite important because if you have an interval that captures the date of discharge but not date of admission, then the diagnoses associated with that hospitalization are ignored. What does it mean that the hospital diagnoses are only recorded on the date of admission? If the comorbidity time interval captures the date of discharge of a hospitalization, but not the date of admission, then the diagnoses of that hospitalization are ignored. While this is a little disappointing, you can always enlarge the interval of time going backwards to capture more than 180 days if you want to see how important it is on increasing that interval of time. A comorbidity method applied to cohorts built on an index date of discharge will not include the diagnoses of that hospitalization in its calculation if the interval doesn't span the admission date of that hospitalization. Comorbidity method applied to cohorts built on date of admission will capture the diagnoses of that hospitalization in its calculation if you start at time 0. We'll actually show this in greater detail in just a moment. Cohorts built on an index date of admission. This can be that cohorts are actually based on an inpatient admission date. where the endpoint event equals to admission. That's the default for the inpatient admission date. You can see here, here's an inpatient event. You can see the endpoint event by default is inpatient admission, not discharge. And you can also do this with an inpatient discharge as long as you reset the endpoint event to be admission. So here's an inpatient discharge. The default is usually inpatient discharge. The default is usually inpatient discharge, but you have to change it to inpatient admission to attach to the discharge the inpatient admission date as the index date. So let's look at this in better detail to make this point for the third time, I guess. Here's the subject at time 0. And now we're looking at time periods 1 day back and 100 days back from the subject's index date. Let's look at a hospitalization. A hospitalization is a durational event. It has an inpatient admit date time and it has an inpatient discharge date time. And let's line it up so that it's related to the subject's index date and the time period 0 to 1 day and 180 days. The first thing we're going to do is we're going to create the blackout period. We're going to try to ignore events that happen on the index date. So we're creating a 1 day blackout, as you can see. Now we're going to tell the program to look 180 days back from the index. And because we have a 1 day blackout, it is a time period from day 1 to day 180 that we're going to be looking for diagnoses. Note, here is a hospitalization in space-time, and we're going to relate the inpatient admit dates and the inpatient discharge date from the hospitalization to this interval over which the comorbidity analytic is searching for diagnoses. We note that inpatient discharge date time actually crosses over this interval of time. But we also know that we do not look for diagnoses at the inpatient discharge moment. We only look at it from the inpatient admit date time. And in this example, the inpatient admit time is not part of this interval. Therefore, this hospitalization and its diagnoses are going to be ignored in this comorbidity analysis. If we wanted to capture this, we would have to increase the interval from 180 days to a larger amount of time. Using this realization to capture the Charlson score for the index admission, when the cohorts are built on admission, is straightforward. You just go 0 to 1 day, you're basically capturing the index admission date time, and you'll build your diagnoses clusters on that admission. If you want to capture the Charlson score for the interval preceding the admission, this is a true severity measure or comorbidity measure that precedes a hospitalization. In a situation where the cohorts are built on admission, you want a blackout period of 1 day so you won't capture the admission diagnoses of that index hospitalization, and you go back 180 days to capture the diagnoses that preceded that hospitalization. If, however, you have a cohort built on discharge, and you want to capture the Charlson score for that index admission, that is for the hospitalization that included that discharge, you have a little work to do. First, you have to open the discharge cohort, and you have to modify the discharge event. You convert the endpoint event from the default inpatient discharge to inpatient admit. So here's the inpatient discharge, and you change it from its default inpatient discharge to inpatient admit. You then update and close, update and close, update and close, and then you rebuild the cohort. Now you'll have the same rows and the same hospitalizations because it's built on discharge, but now each discharge has associated with it the index admission date. Now you can use the rebuilt cohort in Study Designer as before. 0 to 1 day, and you're going to capture all the diagnoses for that admission. To capture the Charlson score prior to the index admission, again, when the cohorts were built on discharge, you have to repeat the previous steps to attach the index admission date time to each of these hospitalizations. You rebuild the cohort, and then you use the rebuilt cohort in Study Designer as before, with a blackout period of 1 day going back 180. And now you will have the comorbidity score for each of those hospitalizations.